Okay, so go for this. Example is the root is gastro. Okay, gastro.
Ano na nangyari?
Hello po. Ayan.
Okay na?
Ayun. Para na po ulit. Sandali lang, share ko lang po yung ano. Saan na ba nagsimula yung So, ito yung sinasabi ko po sa inyo na fan folding bottom linens for close client toward the center of the bed. Ito po pag naggagawa ka ng occupied bed na andun yung pasyente. So, yung kalahati ginagawa mo na, ni-roll mo na yung ni-roll mo na yung soiled linen, and then, para paglipat niya lang doon, hatakin mo na lang siya. Na ano na ba ito? So, ito yung implementation niya. Dito po ba tayo, ate? Tatapos, kanina. Making occupied bed. Bottom sheet, Macintosh Enroll sheet, place the clean bottom sheet evenly, bed folded lengthwise with center fold close at a client back as possible. So, yung soiled linen po niya can be easily removed pag free-nold mo siya. And clean linens are positioned to make the other side of the bed para madali mong magawa. Ifo-fold mo siya. And then tighten the sheet under the end of the mattress and make the metered at the lower corner. Tuck in alongside, place the Macintosh and draw sheet on the bottom sheet and tuck together. Ganyan po siya. So, naglagay ka na ng bago, ni-roll mo siya, para pag hatakin mo na siya yung old one, and then ganun din yung new one na mo na siya. A linen bottom lies nearest to the client and tuck under the soiled linen. Fan fold the dough sheet close to the client and tuck under the soiled linen. Meron po tayong, may forward po ako sa inyo na anong pangalan nito, demo po. At least makita nyo po yung actual po. Kasi pag ganito, dinidescribe mo lang, hindi mo pa ma-imagine, mahirap mag-imagine. So at least pag meron kayo nakikita, mare-remember yun. Now, implementation assist the client to roll over the folded roll linen at the right side of the bed, readjust the pillow sheet. Now, moving the client to the bed's other side, to make the bed on that side only. O, pag minove mo na siya, para minove mo sa other side, the side that nasa harapan mo, para magawa mo na yung half ng bed. Move from the left side, discard the soiled linen, appropriately hold them away from your uniform. Place them in a laundry box. Now, soiled linen can be contaminate uniform, which may come from into contact with other clients. So when you are changing or discarding a linen, dapat away from your uniform. Kasi yung uniform, yung mga microorganism, pwedeng mapunta sa iyo. And wipe the surface of the mattress by sponge cloth with wet and dry. So you wipe with wet one first and then dry it to prevent the spread of infection. Bottom sheet, Macintosh and draw sheet, clean linens and gently pull them out from under the client. Spread them over the bed unmade side. Pull the linen, pull the linen taut. Tuck the bottom sheet tightly under the head of the mattress and meter the corner. Tighten the sheet under the end mattress and make the metered the lower corner. Tuck along the side. Tuck the Macintosh and throw sheet under the mattress. Kasi kaya ginagawa mo ang mga yan, dapat naka-tight siya. Tight yung pagkaano niya, pagkalagay, kasi yung draw sheet, kasi para hindi siya nagre-wrinkled at saka pati yung metered. Kasi yung wrinkled linens can cause irritation for the patient. Hindi lang yun, pag the patient is prolonged already on the bed, nagkakakause yan ng bed sore. So, dapat tight yung linen na ilalagay natin. Ganito siya. You have to grasp the button and draw sheet and pull tightly. Assisting the client back to the center of the bed. Adjust the pillow, return to the right side. Now, yung right side, na-change mo na siya. The pillow is the comfort measure for the client. Clean the top sheet blanket, place the clean top sheet from top sheet of the soiled top sheet. Tucking these pieces together saves time and provides neat and tight corners. Now, eto yung pag nakalagay dito na hold both top of the soil sheet and end of the clean sheet with right hand and withdraw downward. Remove the soiled top sheet and put into the laundry bag. Ganun din po siya eh. Ang lahat ng pagkagawa niya, it's either occupied bed and open bed, pareho lang sila. Ang difference lang pag may patient, mas mabilis mong magawa kung open bed. Pero pag occupied bed, mas mahirap kasi meron din siyang may pasyente na nakahiga doon. The only thing is that na dapat yung pasyente hindi siya mai-irritable habang ginagawa mo yung bed making. At the same time, maging maayos yung pagkagawa mo, type lahat yung mga linens at saka yung metered corner mo, maganda para hindi siya mariwrinkle yung bed mo. Paulit-ulit lang din po ang closed bed. When returning the bed, pag natapos mo na rin yung bed making mo, return the bed and the chair and the bedside of the table to their proper places. Bedside necessities must be within the reach of the patient. Kasi kunwari gusto niya ng tubig, medyo malayo. Samantala pag nasa tabi niya, naayos mo na siya, at naibalik mo sa pinanggalingan niya, madali niyang ma-reach. And replace all equipment in a proper place, discard yung mga linens, and perform hand hygiene. It makes well setting for the next proper line disposable to prevent spread of infection. Same thing from the open one, documentation on the chart with your signature and reports any finding to your senior staff. You have to put the date and time, type of bed, assessment finding observed during the procedure. So, ayan ang gagawin mo rin na you have to document in all things na ginagawa mo sa pasyente, anong klaseng bed ang ginawa mo, anong napansin mo sa patient mo while change mo yung bed niya. You have to take down notes there and then you have to sign signature with the date and time para yung next na shift na-endorse mo siya na ganun ang ginawa mo para yung continuity of care ay madali at madaling gumaling yung pasyente. Now, making a post-operative bed. When client is in return from operating room or from another procedure that requires transfer into bed from stretcher and sometimes from wheelchair, and post-operative bed is prepared. The post-operative bed is made in such a way to make it easy to transfer the client from stretcher to bed. It is a special bed prepared to receive to take care for the patient returning from surgery. Ito yung ginagawa yung post-op bed. After ng surgery, di ba nasa recovery bed tayo. So yun yung piniprepare natin. Kunwari, ma-assign ka sa operating room, ikaw ang gagawa ng bed making ng pasyente. Making post-operative bed, ang purpose niya is to provide warmth and comfort for the patient, to provide protection for the bed from vomiting, bleeding, and drainage and discharge. Ibig sabihin nito, yung pasyente, after ng post-operative na, you have to take care for her kasi usually, yung effect ng anesthesia, after ng surgery mo, usually ang position ng patient flat on bed. Kasi pag once sa flat on bed, andun pa yung anesthesia niya, especially if you have this spinal anesthesia. Kasi ang side effect niya, paggising ka na, nasusuka ka na, or sometimes if you had laparoscopy or any surgery, nagbi-bleed ka na, or there is a drainage, yung may mga pus, ganun, or discharges, dapat you provide the patient care for that patient. Usually pagka after ng operating room nila, flat on bed yung pasyente, and then prepare for kidney basin sa bedside niya kasi there is a tendency. Pero hindi naman lahat kasi usually ang pasyente after ng mga 2 hours or 3 hours ka lang doon sa operating room, depende sa surgery na gagawin sa iyo. Pag nakahiga ka na doon, tapos stable na yung vital signs mo, pwede ka nang i-transfer sa ward. So, during that time, pag nagising ka na, some patient, wala na silang side effect, but some patient, they really do vomiting or bleeding, drainage, or discharges. Arrange the bed and other furnitures in order to facilitate patient from stretcher to bed also. Making post-operative bed, you have to check the room or the ward for the need of disinfection or hygiene of the room. Explain the purpose and the procedure for the client para mas madaling maintindihan ng pasyente bakit ginagawa niyo mag-disinfect, para mas madaling niyang maintindihan at makipag-cooperate, hindi siya madaling matapos. And then bringing all the things that you needed to save time, procedure, and be organized. Katulad ng dati, yung mga ibang gamit sa bed making, but there's some additional only, katulad ng small rubber sheet, woolen blanket, 3 hot water bags with cover. Ito, per necessary kung kailangan ng pasyente. Pag hindi naman niya kailangan, okay lang din. But on the bedside table of the patient, there must be stethoscope, speedometer, kidney basin, wipes, padded tongue depressor, kung kailangan yun. Kasi especially, pagka kailangan niya ng kidney basin, pag in case na susuka siya or any charges, yung dressing ng pasyente after operating, na-soil na, kailangan palitan. So, you need to bring the basin and also to wipe something if there's any blood, any secretion also. And the padded tongue depressor, especially also if the patient is meron silang anong pangalan nito, seizures, sila, di ba, pagka nagsi-seizure, kailangan lagyan mo ng tongue depressor kasi delikado pag makagat nila yung dila nila. So dapat may padded tongue depressor. You have the observation sheet there, nakalagay doon sa tabi ng pasyente. In the room also, there is an oxygen tank with complete tubing. In case of emergency, difficulty of breathing, or any tubes, like for example, sa mga IV line, kailangan niya ng, blood transfusion, kailangan niya ng antibiotic, different type of tubes na nakalagay na doon. Prepare for the patient for any adverse reaction during the operation. Now, suggestion action also, meron din siyang humidifier and nasal catheter there. May mga suction apparatus. Kunwari, yung patient ay madaming secretions, kailangan ng suction na kaya lagay lang doon para matanggal lahat ng mga phlegm or anything na fluid within the parts of the body ng pasyente. At saka stand para sa mga IV fluids, drainage bottle in case na kailangan ng emergency to drain something. Like for example, when the patient has a pleural effusion, may tubig sa baga, emergency, kailangan gawin yun, kailangan natin ng drainage bottle or shock block or IV stand.
Ba't kailangan ng drainage button?
Ito na nga makulit dyan. Now, making a post-operative bed, performance, you have to perform hand hygiene also to prevent spread of infection. You have to prepare all the equipments and bring the articles to the bedside. Organization facilities for accurate skill performance. And move the chair and bed on the side of the locker. So kailangan it makes a space for bed making and helps effective action. You have to move the chair and beds. Strip the bed and make the foundation bed as usual with a large Macintosh and cotton roll sheet. Ito, Macintosh prevent bottom sheet from wetting or soil, sweat, drain or excrement. Cotton roll sheet makes the client feel dry, comfortable without touching Macintosh directly. Kasi yung Macintosh kasi, malamig siya, pero yung cotton, yung absorb, parang yun para siyang napkin, napkin ba na lahat ng mga secretion na dry siya, na-dry yung kahit na may flow ng fluid sa iyo na parang dry siya, hindi agad-agad ma-feel ng pasyente na basa. Now, other thing for the post-operative bed, place top bedding as for closed bed, but do not tuck at foot. Tuck at foot may hamper the client to enter the bed from stretcher. Fold back top bedding and at the foot of the bed to make the client transfer smoothly. Kasi pag finold mo yun, mas madaling i-transfer yung client, yung pasyente. Tuck the top bedding on one side only. Tucking the top beddings on one side stop the bed linen from slipping out of place. On the other side, do not tuck on the top sheet. And then bring head and foot corners of it on the center bed from right angle. To open the side of the bed, it is more convenient for receiving client than the other closed side. Ganito po yung post-operative bed na make closed bed, do not tuck the linens under the mattress, fold. Ganyan po siya. And then fold back suspending portion in 1/3 and repeat folding top bedding twice to opposite side of the bed. Now you have to remove the pillow. Removing the pillow to maintain airway po. Kasi po during the post-operative, sometimes the patient still have effect po yung anesthesia po. Place a kidney tray on the bedside to receive secretion at any time. Pwedeng mag-vomit yung pasyente. Katulad ng sinabi ko, pwede rin po silang may secretion or any secretion or anything na lalabas sa pasyente. At least meron siyang kidney tray. Place IV stand near the bed to prevent moving the to prepare it paglalagyan ng IV fluid soon. Kunwari, may additional pang ilalagay, standby lang siya kung kailangan ng other injectable na ilalagay sa IV or any blood transfusion, may stand na siya doon na available. Check the lock wheel of the bed to prevent moving the bed accidentally when the client or patient is shifted from stretcher to bed. So, dapat parating nakalock yung wheel niya kasi baka mamaya naglalakad na yung wheel yung bed ng pasyente, nakakakos pa siya ng yung pasyente ng accident or any trauma o baka ma-fall pa yung pasyente. Ito yung making post-operative bed from a triangle with a fan-fold linen triangle into meron po akong isi-send ko po sa inyo yung parang video po. Mas madali pong intindihin at matitignan po yung yung video po. Now, meron pa rin po post-operative bed, put hot water bag at the foot and center of the bed if the weather is cold. Hot water bags or hot bottles prevent the client from taking hypothermia, especially kung malamig yung lugar. And place necessary articles on the bedside table and irrigating stand, suction machine, oxygen, set up adjacent to bed. Arrange the unit. So, kailangan andyan yung mga andyan yung mga emergency na gamit para sa mga pasyente in case of something na kakailanganin niya agad-agad. Now, evaluation also, after performing the post-operative bed, you have to return all the chairs and the bedside table to the proper place. Bedside necessities within the reach of the client. You have to replace all the equipments in proper place. It makes well setting for the next one. Para yung gagamit na susunod ay andun din. Makumpleto din yung gagamitin niya. Perform hand hygiene to prevent spread of infection. And then documentation. You have to document on the chart with your signature and report any finding you should tell to your senior staff. Like for example, if you see anything different from a patient na nakita mong na-observe mo, you have to put down a note there. And then you put the date and time, what type of bed that you do, any assessment or finding you observed during the procedure. And then you have to give your signature to maintain professional accountability para yung next na susunod na i-endorse natin at para yung continuity of healthcare ng pasyente natin ay dire-diretso at magaling din, mabilis siyang gumaling. Kasi pag once na may ma-miss tayo na hindi natin na endorse, hindi natin na documented, it will prolong yung suffering ng pasyente at the same time magtatagal sa atin. So mas maganda pagka take down notes natin lahat-lahat. Now, making an amputation bed or divided bed. Amputation is a cutting or removal of body parts by surgery to prevent spread of infection. Like for example, yung gangrene or some cancer, common parts, usually the limb, both upper and lower limb. Amputation bed is a bed that is prepared for patient having amputated limb. Ganito po yung itsura niya, yung amputated. Usually, this amputation, may mga pasyente na na-amputate dahil sa aksidente or also those patients who have this diabetic na yung foot nila, hindi naalagaan ng gusto, and then hanggang naging gangrene na siya, mabaho na yun until you need to cut it already. So, if we have a patient who have this diabetic, we have to take care of their skin, lalo na sa mga foot nila, sa mga kamay nila, kasi very poor ang healing process ko ng paggaling ng sugat nila. Kaya pagka careful lang tayo po. lalo na pagka, ano rin, usually, pag tayo din, kunwari, may history po tayo ng diabetic, you should be watch out also, careful din po tayo. And then making an amputation bed, ang purpose po niya, this bed is made to facilitate the dressing of the stump. And then to ensure that the stump is visible to the staff moving about the ward so that at the glance, any hemorrhage may be observed. It's commonly found in stump quivers. Usually, ito yung amputation ay ginagawa dito kasi undressing. Dapat maluwag yung ano niya, yung area niya na ng pag-change ng dressing niya. Kasi pag hindi rin magandang paggawa mo ng dressing sa pasyente mo, hindi rin mabilis ang paggaling ng healing process ng foot mo or any surgery. Lalo na pagka diabetic foot or gangrene foot. Now, the articles require, you need a cradle, flannel sheet, counterpane, tray with tourniquet, and dressing towel, and bed linen. Procedure, gather all the needed supplies, make the bed as tough you are making occupied bed. The foot and side of the top linen is folded back head and at the level of the part is observed. It must be below the knee amputation. Ito yung ano niya. Spread of and then the spread of second set of linen is start from the level of the stump. And the second set of top linen should be overlapped the first by 8 to 12 inches, and then receive the patient and elevate the stump on a small pillow and place the sandbag or either the side to support the stump. Place the bed cradle in a position and cover the patient. Usually, asan ba? Ito yung amputation. Usually kasi ang mga amputation patient, meron silang sinasabi ng false limb, pakiramdam nila na wala na silang pakiramdam. So, we always observe din dito yung kino-cover natin sila at saka minsan may psychological and emotional effect for the patient na amputate. Hindi nila matanggap, ganun. So, we should be, yung bang careful tayo, at saka hindi tayo harsh sa kanila kasi may pinagdadaanan sila. Masakit kasi pag once na naputulan ka, any parts of your body. Now, we will go to fracture bed. Ang fracture bed naman is one which used for patient with fracture of the trunk or extremity to provide a firm support by the use of firm matters at rest of the bedboard or fracture board. Ganito po siya pag may fracture ka. Ang dami mong contractures na nakalagay po. Na dapat immovable yung pasyente para yung pag-healing process ng ng bones mo ay madali. Fracture bed indication, aid in immobilize the fracture, prevent unnecessary pain, provide warmth and comfort for the patient, prevent undue sagging of the mattress. Usually this one, ang fracture bed ay talagang to immobilize the fracture. Dapat maganda, hindi sagging yung mattress niya. At saka maganda yung bed making mo kasi konting bagay lang dyan may pain din sila. Articles require supplies as an open bed and extra supplies like fracture board, bed cradle, sandbag, cover sheet, hot water bottles with cover. Ito, ginagamit naman ito as necessary, PRN, required ng pasyente. Ang procedure nito, gather all needed supply, place the fracture board directly over the bed, and then make the bed as open bed and spread the cover sheet between the bottom and top sheet. Place the hot water bottle in between the warm bed. And place the sandbag to support part in order to maintain the position. When the patient is received in bed, place the cradle over the fracture part and cover it. Kailangan din siyang coveran kasi for the confidentiality po. Ba't andyan na siya? Kanina pa ito. Oh. Naghalo na. Tapos na ito. Doble-doble. Now, another one is the cardiac bed. The cardiac bed is made with simple arrangement are required by cardiac patient. Cardiac patient bed is made from a manner that ease respiration for the patient. Bed provided with extra pillow to keep the head side of the patient and keep the patient in front of position for better airflow. There is a special cardiac table provided with the patient bed with equipment available for emergency cardiovascular support like oxygen, mask, nasogastric tube, and others. Ganito po yung itsura ng cardiac bed po. Usually po yung mga patient na cardiac, may cardiac problem, they have difficulty of breathing. So, ang position ng bed niya ay medyo naka 45 degrees or sinasabi nila na Fowler position. So, in case na dapat nakataas para makahinga siya ng husto. Tapos meron din po siyang nakalagay na table. Sabay mo. Na table para andun yung mga emergency kit para sa kanya in case of emergency po. So ayan po yung bed making natin. Kung may tanong po kayo, tanong na lang po. I-forward ko na po sa inyo at least para
Can I ask question? Can I ask question, ma'am? Ma'am, can I ask question?
Hello po, Anita. Rochelle. Any question? O sige, mag-exam na kayo. Gusto ko ngayon ma-perfect yung quiz ha. Ano yan, madali na lang, may enumeration. Sigurado naman yan, ma-perfect na rin yung... Hello? Ba't nakamute lahat? Ba't nakamute lahat? Ready na kayo? Yung quiz ninyo, isi-send ko mamaya. Mag-exam muna kayo. And then, ano pangalan nito? Mag-isa muna kayo, then send ko afterwards. Gusto ko makahabol kayo lahat dito. Hi, perfect nitong communicable disease. Madali lang itong communicable disease na ginawa ko para makahabol kayo panghatak doon sa first examination po. Okay lang?
Okay na po.
Okay na. Send ko na lang po. Then okay lang ba na anong pangalan nito? Isulat na ninyo, tapos sana paki-clear na lang po yung yung sulat po, tapos picture na lang. I-picturean na lang din po para madaling or kung masipag kayo, pwede nyong i-type.
Sulat doktor po kami.
Okay lang, sige. Naintindihan ko naman. I-send ko na yung nyo, yung exam niyo. Sandali ha.
Hello.
Hello po, ma'am.
Ngayon din po i-submit yung exam? Okay, sige.
Opo. Mabilis lang, te. Ano yan? Kayang-kaya nyo. Binilisan ko na may enumeration. Madali na. Open notes naman. Gusto kong mahatak nyo yung yung last time na Pero wag na lang po din yung i-share po kay kay Frank at saka kay sino ba yun? Kay
Sarah.
Yung mga hindi naka-attend po ngayon, pwedeng wag na lang pong i-share kasi mag-exam pa rin po. Isang klase lang po exam din yung sa grupo.
I-send na lang po sa iyo personal.
Oo, isend na lang po ninyo sa akin ng personal yung result ng test ninyo po. Ito wala. Sandali lang po ha. Hinahanap ko. Ayan. Teka, ma'am ha. Andito yun. Sandali. Gusto na yan. Sandali lang po, hinahanap ko po dun sa ano. Sige, basa lang ho muna kayo. Sandali lang po. Nasaan na siya?